Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19? Didn't diagnose, but I'm sure you'll appreciate the mental gymnastics. I worked obs and ginny a few months back. For obstetrics we had an amber ward, confirmed non-COVID ward, and a red ward, confirmed COVID/no test done. We'd require mum and partner to both get COVID tests done in our clinic the day before the planned admission, so we knew which ward to place them in. One patient refused to have the swab taken because she thought COVID was a hoax. So we were told her she'd have to stay in the red ward during her admission as we couldn't confirm she didn't have COVID if she didn't have a test. She went absolutely mental saying you can't do that. What if I get COVID? Bruh. A friend of mine has COVID denier parents. Her dad is a pastor in Oklahoma. He contracted COVID because they were having services without masks, since this whole COVID thing is just a way to suppress Christians, and came down with a pretty severe case. After it was all done, they remaining COVID down players / anti-mask anti-vaccine, because God kept them safe and it wasn't that bad since they didn't get hospitalized. Her mom had a very mild case. Oh, but her grandma died. But since she was already ill she went on hospice, so it didn't count. Got a relative just like this. Was having a conversation about COVID. He was speaking the it's fake news, blah, blah blah. That dies down. He mentions his mom died. Oh shit, of what? COVID. I mean, it was clots in her brain. But they marked it as COVID. I'll let it go. Dude wasn't going to change his mind. But that is one of the direct results of COVID. One of my COVID minimizer, anti-mask relatives is in the hospital with COVID right now. His wife is throwing shit fits all over the place because they won't allow visitors without a vaccine. I feel bad that I don't feel bad. I just hope they didn't infect anyone else. Doc chiming in. They told me I was wrong. Obviously, there's no way they had COVID despite coming into the air for shortness of breath, cough, and fevers. When I mentioned that their wife who was several rooms down also had COVID, their response was, oh, that makes sense, because she always gets sick. When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino. Eat and drink in the casino? Oh. You mean the place where everyone is partaking of risky behavior? I had a lady who was maximumed out on high flow, next step is breathing tube, who still refused. She had COVID and was holding a negative test in her hand that she had taken a week prior, the COVID equivalent of the Black Knight from Monty Python and the Holy Grail. I actually feel bad for her. It sounds like she wasn't denying that COVID exists, just that she had it and was stuck in that denial stage. I work on a COVID unit and I ran into a patient like this. They'd tell me over and over again about how they weren't really sick and about how I didn't need to be gowned up in PPE. They even tried to take my face shield off. If you test positive for COVID 2 times then you have COVID. People are crazy. I had a patient grab my CAPR cord and tell me I didn't need it, as they're sitting there on BPAP after dumping their sats into the 70s just trying to take a crap on a bedside commode. I had to tell myself they were in denial about the fact they were dying, but fuck if they are taking me with them. I'm an anesthesiologist, and in our institution, we are the ones tasked with intubating COVID suspects / positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. When was the stage of the Black Death where people said no, this isn't happening to anyone? This is a trick of the devil to make us think God has abandoned us. No one is actually sick at all. Are we just worse at scientific reasoning than 13th century peasants? Still had to treat her despite her accusing me of hiding the real diagnosis from her and doing something to make her sicker. Love my job. I can't fathom that people really believe that in a pandemic their likelihood of having COVID is so low that they accuse people of hiding a diagnosis. Makes no sense to me. I'm an attending physician at our Triage unit. On a Friday, an older gentleman, 60 years, came in with his entire family, wife, sister, Bill, 2 youths and 3 children. None of them with a face mask. All had mild COVID symptoms except him. He was saturating 80% with evident shortness of breath. We insisted in doing PCR and a chest CAT scan looking for COVID, but he and his wife refused, saying that COVID wasn't real, and it was just a bacterial infection. The more we talked with him, the more agitated he got, to the point that his face was red. We suggested hospitalizing him to stabilize him and start treatment. But they accused us of exaggerating his symptoms, and that we only wanted to hospitalize him so we could steal the liquid in his knees, a stupid rumor that was going around when this whole thing started. They both cursed at us and said they were going to a better hospital to get antibiotics. Fast forward 24 hours later, on Saturday, we get a call from the hospital next county over telling us that they intubated one of our patients because he went into respiratory failure when he arrived, and they had to transfer him here because they don't have the appropriate equipment. We transfer the patient on Sunday, only to find out on the CAT scan he had 90% of lung damage. He passed away on Monday morning, just before the family took the body away. I gave the widow the death certificate that I filled out, and before walking away, she turns around and waves the certificate yelling, "See, I told you it wasn't COVID." It says here, death due to pulmonary pneumonia due to SARS-CoV-2. I knew it was a bacteria. I told her, SARS-CoV-2 is COVID-19, ma'am. Edit, because everyone's asking what happened afterwards. Not much. She yelled, "No, it's SARS. It's a bacteria," and stormed off. It's actually one of the mildest encounters I've had with a grieving widow. RN here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us, but honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. COVID didn't care is a great quote. My uncle claimed he's take his chances with COVID during our masked, socially distanced Easter get together at my grandmother's house, and that he was very hesitant to get vaccinated when many of my relatives have already gotten the vaccine and none of us have turned into 5G goons, only to test positive for the virus literally that evening. Ever since, he has been fighting for his life and has seen the reality of the situation and has finally agreed to be vaccinated once he recovers. It's shocking that it takes such an awful close encounter to turn people, and that others go to their grave having been deniers. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with CO fever and diarrhea. The child was severely dehydrated, and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get covered without leaving the house? She had called her husband. He came with 10 to 15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. I'm a student, funeral director, and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for COVID deaths. Suddenly there's changes of heart. Physician here. The willful cognitive dissonance is real. It never ceases to amaze me how many patients will refuse assistance from me to register to get vaccinated, make claims that vaccines are harmful, but then accept my medical care on anything else that suits their whim. Patients absolutely have autonomy to refuse care, but why would you continue to see a physician and accept their medical advice and care if you think they would simultaneously recommend something to you that would be harmful? I've posed this question to patients who are vaccine hesitant. Why would you let me manage your diabetes and hypertension if you think I would harm you by recommending vaccinations? You cannot get any kind of thoughtful response aside from, "I just don't want to be vaccinated." As an anesthesiologist, by the time someone's calling for us, it's for intubation and the patient is in no condition to deny anything. Honestly, it's usually the family that's the issue, and that needs to be escorted from the room. That boggles my mind. By that point they can see that their loved one is having trouble breathing, and they are still trying to keep them from being treated. I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months. Probably 300 cases. The one that sticks out in my mind the most was a 70-year-old lady with COPD. She refused to have a vaccine because she didn't trust it despite the fact she was eligible for one 4 weeks beforehand in the UK. Subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course she deteriorated over a number of days to the point where she was on maximal oxygen on the ward, and at that point finally accepted treatment in HDU with high flow oxygen. Although continued to doubt she had COVID, died within 24 hours of her HDU admission having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately there's no treatment for stupidity. Edit. Spelling. My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE, like gowns, goggles etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 over 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. My mom works for an OBGYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out but not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. I'm a family doc who mostly does outpatient. I live in a pretty conservative area with a good proportion of COVID deniers, so I've been seeing COVID deniers since this mess became politicized. I've lost a few patients over the mask mandate. Anyway, I'm pretty pleased to say that several of my COVID denying patients have completely turned their attitude around when they, or a close family member, contracted COVID, even if their case wasn't severe. The sudden terror that they could wind up on a ventilator overnight really puts the fear of God into people. Unfortunately, I still have some patients who are still pretty obnoxious despite their COVID diagnosis. They mostly dig in deeper into paranoia. If not about the virus itself, then about the circumstances surrounding them contracting it. If Fauci had done his job from the beginning, it never would have hit this town. It's the entire fault of Obamacare that I can't get the experimental immunoglobulin treatment. It's not. Your eligibility for the infusion is dependent on a list of risk factors, and probably my favorite. So I have COVID, and it's completely your responsibility to fix it. I need you to send hydroxychloroquine, zinc, BD, lisinopril and azithromycin to the pharmacy. Then they proceed to get pissed at me when I don't. And yes, each of those things were actual things patients said to me after getting their diagnosis. I could probably think of more, but those were the most memorable ones. Not a doctor, but nurse that worked in one of our covered ICUs. Lady was intubated, sedated, pronounced. Therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick COVID patients. The whole shebang. Miraculously she recovers and is weaned down to high flow nasal cannula. Still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give med/care, simultaneously yelling that COVID isn't real and that we gave her COVID. God, this winter sucked. I was hospitalized in the ICU for a while and wasn't far off from intubation myself. I was lucky and responded well to donor plasma and remdesivir and was able to recover surprisingly quickly once the pneumonia started clearing up. If it makes you feel any better, there are many more of us that considered you folks fucking troopers and incredible. I made sure to thank each and every one of you every time they came in, from the multiple blood pulse attempts at least before I got my midline, the multitude of breathing treatments and shots, to having to balance my giant 6 feet 5 inch ass to the bathroom once I was able to walk enough to piss in an actual toilet. You guys saved my life, and I'll never forget it. So, something to consider when the behavior of these shitstins wear you down. Edit. Thanks for love. Folks, one thing to add, the other thing that saved my life was quitting smoking 5 years prior to this. I weaned myself off with a vaporizer for about a year before dropping it entirely. Seriously, if you're smoking, quit, because it may bite you in the ass sooner than you think. Family members have come in with a sick family member and lied about exposure and/or symptoms, despite a member or members testing positive. This has led to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Edit. Typo. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. I have treated a young male in our ICU with critical COVID-19 with severe diabetic ketoacidosis. He did not believe in insulin. Yes, you are reading this right, or other antidiabetics. Even though insulin is inexpensive in our country, he tried to treat his type 2 diabetes with herbs. His HbA1c, the lab value showing the state of his diabetes on the longer run, was off the roof. He did not vaccinate, he was offered, did not wear a mask, did not distance, and did not believe in any of this corona bullshit. Most of this information was obtained from his 20-year-old daughter, as he was quite disoriented at presentation and was intubated urgently. She was sobbing through the phone every day for 1.5 months until he died. I held the phone with his daughter on call to his ears multiple times when he was still intubated, but his mind cleared up and his sedation was optimal. I was quite convinced that he realized his mistake on the ventilator, with lines and tubes inserted into his body everywhere, and in his last clear moments, when his mind allowed, but I cannot be absolutely sure. I often think about the last conversation and last mental images people have before their death. A doctor here. I diagnose people with COVID on the daily. Some people are actually really great about it, others are more difficult. I'll tell you a tale that occurred during my most recent shift. Back-to-back rooms and patients. Patient A, in room #4, is a 23-year male. No medical history, comes in with body aches, malaise, and fatigue. Also had some mild nausea without abdominal pain or vomiting. Patient B, in room #5, is a 51-year female. Medical history of intermittent asthma, so she uses a puffer infrequently. Comes in with shortness of breath. Has some possible fevers at home. In Triage it was noted that this patient's oxygen sats were in the 88 range and her heart rate wasn't elevated. Interestingly, when asked if she thought she had COVID, she said, "I can't have it. I tested negative 2 weeks ago when my son tested positive. He's been sick at home." You guessed it. Both people COVID. Patient A went home. He's doing great. Was extremely remorseful, and before he'd even left the ED he called his work to let them know he was positive and to get everyone there tested because he figured he had gotten the illness at work. He worked in a small family-owned warehouse as a foreman. He also called his parents and they were getting him set up to sleep in the garage until his quarantine was up. I respected this guy. Patient B got admitted to the hospital because her O2 sats weren't great. When I went back to tell her she was COVID, she called me a liar and told me I must have made a mistake. She threatened to sign out Amma against medical advice, but when she got up to leave, she got so short of breath the nurse used that to convince her to stay. People are strange sometimes. I try not to let stuff bother me, but covered deniers come very close to crossing that line. IQ/covered IQ charge nurse here. Had a woman try leaving the ER against medical advice with COVID and was needing tons of O2. Our docs convinced her to get admitted. My wife was her ER nurse and brought her up to me. Patient was yelling and screaming, ripping off her mask, spitting and telling us we're all sheep between gasping for breath. Our docs told her she was close to needing to be intubated, breathing tube, and she just scoffed. We reached out to the husband who proceeded to swear and berate us, telling us we're keeping her prisoner, no visitors in our covered unit, and that we can do whatever we need because none of this is real and it's all for show, so you guys can get paid. She gets intubated, decompensates over the next few days, and finally codes. We code, perform CPR, give medications, defibrillate, etc. her for well over 1.5 hours before calling her time of death. The kicker was calling her husband and getting absolutely excoriated because we injected her with COVID as an experiment and killed her. He then had to be escorted out of the hospital when he came in to try getting up to the unit without a mask, of course. This shit's getting exhausting. Not a doctor, but my wife is and a few of our family friends are as well. One of them is sports medicine/family. The guy came in, refused to use a mask. Our friend refused to treat him until he masked up. He had a newborn at the time too. When our friend told him he most likely has COVID, he needs to go to Tampa General immediately for testing and treatment, the guy said no. It's fake, he just needed some antibiotics. He left without getting a prescription, called back that night, demanded to be given oxygen. Our friend told him his only option was to go to the hospital. Guy had a severe case of COVID and ended up being hospitalized for a few weeks. He still thinks it was fake and was only a severe flu. I was testing a guy yesterday who asked me if he still needed to be tested in order to be on a college campus, even though he had received both doses PF Pfizer already. I said yes, it's a CDC mandate, and there isn't enough longitudinal study on the current vaccines' effectiveness on the variants to make a call on that yet, so we keep testing everyone once a week. Then he hits me with, you know all this COVID crap is bullshit, right? Fucking government and Illuminati spooks trying to suppress us. I told him that 92 people have died of COVID under my care in the last 14 months. To keep his canon garbage to himself and to have a nice day. I got reprimanded this morning, lol. Most worth it slap on the wrist of my life. Edit. Hey, thanks for all the sweet Reddit clout. In lieu of any awards that may cost money, I would instead recommend that you donate to the Nurses House, which is a foundation that assists RN struggling with mental and financial well-being. They do some great work. Thanks again.